Good afternoon, everybody. Thank you very much indeed for joining us for this latest briefing from Greater Manchester. Going to introduce Deputy Mayor Beverly Hughes later, and I will do my own overview in a little while. But first of all, I'm going to invite the Chief Constable of Greater Manchester Police to provide an update, and we'd ask you to put questions directly to the Chief Constable for the first part of the meeting before we get into the more general update. So over to you, Ian.
Thank you, Andy, and good afternoon, everybody. Obviously, this week has seen the legislation change from the first part of the lockdown, and the first thing I just wanted to say is that we've seen really fantastic compliance right across Greater Manchester, and I wanted to thank the public for that through this difficult period. Dealing with emergency legislation is never easy for my officers, and I think that we've tried to do that in a very proportionate way, engaging with people, explaining, encouraging, and only enforcing as a last resort. We have issued just short of 300 fixed penalty notices right across Greater Manchester during that period, and I think for me that just reinforces the very proportionate way in which we've tried to deal with this very difficult period. The relaxation of the lockdown that the Prime Minister announced was always going to prove to be more challenging for us as we move forward, given that we've gone from what was a relatively strong message with some fairly clear legislation that backed it up into something that's now more fluid. And I think from a policing perspective, that was always going to make it slightly more tricky as people have more leeway around what they can and they can't do. I think going forward, our focus very much will be on our usual core business around open spaces, making sure that we're dealing with any outbreaks of public disorder, dealing with any assaults or antisocial behaviour, and really the legislation that we now have for enforcing the coronavirus legislation will very much be around dealing with large groups of individuals or problematic individuals. And the government have tried to send out a message to those people by saying, the fines are increasing to £100, and of course they can double if they're not paid up to a maximum of £3,200. So that's the message that's being sent. From a policing perspective, we will deal with that as and when it arises. But I think, as was with the original part of the lockdown, we are relying on people to self-police, to work with us, because at the end of the day we all want the same thing, which is to make sure that we can protect each other, protect our loved ones, and prevent the spread of the virus. So I'll stop there and take any questions that anybody would wish to ask.
Thanks very much, Ian. I'll go to James Much at the Bolton News. It's been mentioned before that house parties have a particular challenge in Greater Manchester during the lockdown. How is the force handling this problem now? Is a new approach being used to deal with it?
So the house party issue hasn't gone away, and last weekend was particularly busy with the bank holiday. I think people are well aware that there was no power of entry with the legislation that we've been using over the last few weeks. So we have taken people to court for other offences, public order offences. We have also done closure notices on a couple of premises as well, which the Antisocial Behaviour Act from 2014 enables us to do. That prevents people going to that property other than the homeowner. And we'll continue to do that in line with local authorities, because clearly, the guidance has not stopped people being able to go to other people's houses. That has remained the same. You should not be going to other people's houses. So we will continue with that as we go forward.
Thank you. I'm going to take a question from Ian Herbert, who's a sports writer at the Daily Mail. Chief Constable, do you support the idea of the Premier League recommencing in June at all 20 home venues, including Old Trafford and the Etihad? And do you think that could have a detrimental effect both on attempts to ensure social distancing and police resources?
Well, in terms of when that starts, and I'm sure the Mayor will have a comment on this, I mean, from my perspective, it's got to be safe from a health perspective, and it's got to be safe from a public perspective. What we're fearful of is that people will turn up either at neutral grounds or at home grounds, and some of that could be particularly problematic. So, you know, I'm not saying from a policing perspective it would be impossible to police, because clearly it wouldn't. You know, we police hundreds of thousands of people in normal circumstances at events right across Greater Manchester, but we are in very special and difficult times, and it remains a health issue. So the thought of large groups of people coming together and not practicing social distancing is a difficult one, and I think, you know, we've all got to get to a position where we feel that it can be done safely without jeopardising people's health, and that has to be the starting point for me. The next bit then is, you know, what provisions can the clubs put in place to prevent people coming, and obviously we can use legislation where it's applicable to stop that as well. There's some quite tricky fixtures potentially. You know, Liverpool coming to Manchester City, I have no doubt would attract crowds whether they're allowed in the ground or not. So, you know, it needs very, very careful thinking through.
Thank you. I'm going to bring the Mayor in on this one as well.
Thanks, Ross. Just to add a couple of thoughts from my perspective to your question, Ian. There's a number of ways of looking at this, but I think the best way to approach it is to listen to the people who would be most affected by any restart, and that, of course, is the players, the managers, and the officials. So people here will have seen comments by Raheem Sterling in the last day.
Hold on, Andy. Sorry, mate. The event's disconnected. Can we wait till it reconnects before you resume? Okay, looks like you're back on. If you wouldn't mind repeating that last point. Sorry, Andy.
Okay, I think I'm not sure, colleagues, if you lost me there, so maybe I'll just start that again. I was just saying, in answer to Ian's question, there's a number of ways you can look at this, but I think the best way to approach it is if you start with people who are going to be most affected by any resumption of Premier League football, and that, of course, is the players, the managers, and the officials. And people here will have been struck by Raheem Sterling's comments in the last 24 hours, saying he doesn't feel particularly safe, particularly having lost people that were close to him, and of course Pep lost his mum. You have to take on board the concerns of the players, and I think other players have been speaking out in the last day or so, and surely their views really should be taken as priority when it comes to any restart. So it's about their health, their safety, and it's not being dictated to by television or by money. And if players are not in a position where there's a clear feeling that they should return, then I think there shouldn't be a return. The issues that the Chief Constable spoke about, I think, add against any early restart.
Thanks very much. A question to the Chief Constable from Josh Halliday at The Guardian's. A couple of questions here. The College of Policing guidelines released today state the police will not be able to arrest or fine people for breaking social distancing rules. Do the more relaxed restrictions enforced from today present a greater challenge for officers? And you'd also like to ask if whether GMP has seen an increase in domestic violence reports since the lockdown on 23rd of March, and if so, if you have any figures.
So the social distancing 2 metre guidance is just that, guidance. It's not been legislation, so we've not ever been able to enforce that. And to be quite honest, nor would we want to. That's about public health. It's not something that the police should be enforcing. So I think officers are absolutely fine with where the guidance from the College of Policing stands on that today. In terms of does it make it trickier? Well, I think I outlined that in my opening, that I said, you know, when we move to a more fluid situation, which was always going to be the case as we ease out of lockdown, the policing of this becomes slightly more complex, which is why I think we have to stick to more of our core role and existing legislation that we're very used to using. In terms of domestic abuse, we've done a lot, as the Deputy Mayor, to make sure that we have been supporting victims and making it very clear to victims that, they can continue to report domestic abuse throughout this period, and there are ways of us making sure that they are supported through victim services and such like. We've seen a very small increase in reported numbers. It's about 1%. So we've averaged around 100 reports a day across Greater Manchester throughout this period. But nevertheless, we are very mindful that perhaps people haven't been able to report or felt that they've had the freedom to report during these current restrictions. So we will continue to work with victims, with victim services and with charities to make sure that domestic abuse victims can access the services that they require.
Thanks very much, Ian. I'm not sure if Bev would like to come in on that point or not.
Thanks, Ross. It's just to concur really with what the Chief Constable said. This has been a priority right from the beginning, and our ACC, the Assistant Chief Constable, leads on this, has pulled together with me a group from all the districts, all the 10 local authorities, and they're all working together to make sure that victims know that they can approach the police and indeed voluntary organisations if they don't want to report it to the police, as some don't. So we've been very concerned to watch this and monitor it. There have been fluctuations every week. Sometimes it's slightly above 100, sometimes slightly below. But unlike other crimes where we've seen a 25 to 30% reduction in demand, domestic abuse has stayed roughly around the business as usual level. So we're watching it very, very carefully.
Thank you very much. Question, I think it's probably 2-3 more questions for the Chief Constable. Take one from James Much again, which is very simply, what is your message to people who are spotted blatantly flouting the rules?
So I think the message is quite simple, that we are still in the middle of a health crisis and people are still dying. So please act responsibly. Please think about your loved ones and your friends, and potentially, that you're putting them at risk. And we would ask you not to do that. And then I'll be very clear that where we can use the legislation for those people, we will use it.
Thank you. And a final question for you, Ian, from Andy Bounds at the Financial Times. Have you seen any increase in traffic on the motorways and other roads today, given the back to work message from the government?
I haven't got the exact figures for today, but we have seen a steady increase throughout the lockdown period, I suppose, which was inevitable as people got used to the restrictions and some businesses returned to work. So we've seen a sort of that steady increase over that period. I understand there was slightly more traffic on our major road networks today, but still nothing like the levels prior to the lockdown earlier in March.
Thanks very much. I think that's all the questions for you, Chief Constable. So I think we can go back to Andy.
Okay, thank you.
Thanks, Ian, and thanks, Ross, for moderating. So, colleagues, I'll provide my update on the basis of the reports given to the Greater Manchester COVID Emergency Committee that we've just held. Some encouraging signs in that though we have a significant number of new cases, again in Greater Manchester, they are becoming fewer each week, and this week was down on previous weeks. The overall number of cases reported to the committee was 527. Sadly, a further 105 deaths across our 10 boroughs, and obviously our thoughts are with all of those families grieving at the moment. So an improving picture, although challenging in different places. So if we look at hospital admissions, which is a figure I've encouraged you to look at before, we were running at 22 admissions to hospital of patients with COVID-19 this time last week. The latest figure I have is 28 for yesterday. important not to read too much into that. You could say it's broadly flat, but of course, we are watching these things incredibly closely. If you look at care homes, we now have a total of 338 care homes who have at some point had an outbreak. The figure as to how many are experiencing an outbreak right now is around 34% of our care homes. So around 1/3 of the 500 or so care homes in Greater Manchester are currently reporting an outbreak. And obviously that is a figure that continues to give us considerable concern. In terms of the number of patients in hospital, this time last week we had 116 people in intensive care. That has fallen to 91 as of yesterday. And in relation to non-intensive care, 745 people were in more general hospital beds. That has fallen to 701. So overall, some signs of improvement, but certainly no complacency at all, and a significant challenge that we're still dealing with. One figure that was reported to the committee today, at my request, was the R number for the northwest of England. You may have seen yesterday that myself and the Mayor of the Liverpool City region have called on the government to publish the R number, the rate of infection number, for all English regions, given the new context in which we now find ourselves, and the need for heightened vigilance around the spread of the virus. And for the northwest, the R number is currently 0.70 to 0.76, and the median figure quoted is 0.73. So obviously that figure will have more meaning when we see it for other regions, and we would very much encourage the government to provide that level of transparency so that we can see the rate of infection across the English regions. And we suspect that it would be lower in other regions, and that's why we think this comparison would be helpful for the public and for people here to see the level of risk that they face. I've also put a proposal to the committee today for the number of new cases to be published by borough across Greater Manchester. We want to take care to get the presentation of that data right, but once we have done some further consultation on that, we will soon start to publish that on a regular basis. The committee heard today about personal protective equipment. I can certainly report the best position that we've had for out of hospital care in primary care and social care, with no immediate problems with supply. More challenges in the NHS, in the hospital system, but that seems to be linked to issues with the national stockpile. But of course, we are working those issues through. Just touching on two further issues, we had a long discussion today about the strategy for mass testing and contact tracing. Progress continues to be made on an enhanced contact tracing system for Greater Manchester, and it's now been acknowledged at a national level that there does need to be a strong regional and local input into any national contact tracing system. However, considerable concern expressed by both health service colleagues and council colleagues about the current state of the testing system. There is a feeling that in the last few weeks we've been chasing the numbers but not actually developing a coherent testing strategy. And of course, the testing is needed to support a contact tracing system as it comes into place. Now, both of these things are not yet in a position where they need to be to enable us to keep close surveillance on the virus at a local level. And it's why I want to reiterate the concern that I've aired in the last couple of days, that I think the change in the national message and in the national guidance has come too soon for the northwest of England, given the higher number of new cases that we have. My concern is that people here are exposed to a higher level of risk than in other parts of the country. And that is why a lot of my emphasis at the moment is on improving the quality of that data at a regional or a local level, so that people can understand the level of risk and take steps accordingly. On the back of all of that, I want to reiterate my advice to the residents of Greater Manchester today, which is to take a cautious approach to the changes that have been announced today. I would ask people to take time before making any major changes to their routine. I will be working hard with the team to provide people with more information as we go forward. But I would urge people both to be careful about any changes in their work or their own daily routine, but also very much to listen to the Chief Constable in not gathering, continuing to respect physical distancing of 2 metres, and recognising all of the time that the challenge here in the northwest is a bigger challenge than people are facing in other parts of the country, and we all individually and collectively have to be mindful of that. I will finish on one point about public transport, and again it relates to what was announced on Sunday. I have expressed concerns to the government that there was no meaningful consultation nor proper advance warning about the changes announced on Sunday evening. And of course, those changes have had an impact on the transport system. The figures that I have from Transport for Greater Manchester are that there's been a modest increase in the number of people travelling by tram and also by bus, although particular services at particular times of day may result in significant numbers of people on board that may in turn then make physical distancing difficult. And we've seen that here, but also particularly in London as well. There has been an increase in the number of cars on the strategic route network. I think that's about a 4% increase on the numbers that I've been given from Transport for Greater Manchester today, which is significant, but of course nowhere near normal levels. The point I'm building to here is we are in a very difficult position with people being encouraged to return to work, but before we are in a position to increase the number of services we're running, or indeed the capacity that we have. We have, as I've said before on this call, not been fully funded for the costs we're incurring on Metrolink. So on the 20-minute service that we're currently providing, we're getting around 3/4 of our costs covered from the government. And we have no easy way of covering the remaining 25% of costs. What that means, of course, is without further support, we can't increase the frequency of that 20-minute service. And therefore, the risks of too many people being on our public transport system is very real. And the same applies with buses. We can't operate sufficient capacity with physical distancing unless we receive funding to run more trams and funding to run more buses. And on a call with the 8 other metro mayors across England, this same point was felt by all of them. And we all believe the government needs to support us to increase public transport capacity so that we can safely support people's return to work. So I'll leave it there, Ross, and I'm going to invite now the Deputy Mayor to provide her update before we move into your questions. Thank you.
Thank you, Andy. Well, I think the Chief Constable has covered much of what I would say in terms of the overall position. I think up until last Wednesday. It was very clear what the police role was. They were very clear. I think the public were very clear about the strength of the message to stay at home. I think when the Prime Minister announced last Wednesday that he was going to relax the restrictions on the following Sunday, I was very, very concerned about what would happen over the coming bank holiday weekend, because I think whilst the majority of people, as Ian Hopkins said, were absolutely compliant with the restrictions, there were a minority that have gathered and have behaved in a way that's really not conducive to containing this awful infection. And so we saw that weekend a considerable increase in large gatherings every day over that weekend, over 1,000 actually on between Friday and Saturday, house parties and street parties and gatherings and so on. Nonetheless, the police responded to that in the same way as they have been doing, with engagement with the public, with encouragement, with explaining, and very few fixed penalty notices, but with the potential to disperse those gatherings because they have the legitimacy to ask questions. With the relaxing of the restrictions, I think there's a lot of uncertainty, both amongst people themselves. You know, the message is not clear. The message is stay at home, but now you can go out as much as you like, and not just for exercise, but for recreation. You can mix with another member of another household. You can mix after that with a member of another household and successively meet with individual people in a public space. I think that's very unclear for people. That's my impression talking to people I know, and many people are very worried about that. I think secondly, for the police, it's less clear for them. Certainly the basis now upon which they can ask questions is much more limited. They can't really ask people now any longer, you know, can you mind telling me what you're doing? The only thing they can ask is, who is this you're with? And is this a member of your family or not? And I don't think the police actually are going to find it very easy or want to get into that kind of territory. So as the Chief Constable said, I think the limit of their activity will be in terms of making sure that any gatherings that do take place are orderly and people are kind of behaving as you'd want. I think, you know, it does depend largely on people's good sense, and I think, you know, by what we've learned so far, the vast majority of people will be still concerned about their own safety and that of their families, and they will behave in a way which recognises the potential to be infected if they get too close to people, and the police will depend on that. So I'll leave it there, Andy, thanks, and I'm happy to obviously take any questions.
Thanks very much. I'm going to start with a question from a number of questions for Andy from Kevin Fitzpatrick at 151. The first question is, for weeks you've been saying there mustn't be a phased easing of the lockdown across the country. Now you're saying you want the regions to decide when they reopen. Why the change in position? And then secondly, oh, Andy, I think you're on mute. Apologies.
Ross, I'll just deal with that question. Because I think it's important to deal with it head on. There is no change in position, Kevin. I've consistently opposed regional phasing of release from lockdown, and I remain in that position. And that's not what I've called for today or with Steve Rotherham yesterday. What I've called for is publication of the data about the R rate across the country. And the reason we are calling for that is we are worried that the Northwest may be at higher risk, and therefore we think people here need to be able to watch that R rate very carefully and compare it with the R rate in other parts of the country. I'm not calling for any regional lockdown. What I'm calling for is the ability for people here to understand what's happening and the level of risk here by having transparency about that data. I personally believe that the approach that was announced on Sunday, time should have been taken to demonstrate that it was safe for all parts of England, recognising that there is a big difference in the R8 from the northwest to other parts of the country. Now, I have not been reassured that it is safe for all parts of England. Hence, it's my job now to speak up and protect the residents of Greater Manchester, and that's why I'm calling for them to be empowered with this particular information. And I know the Mayor of the Liverpool City region feels the same. I still take the view that if it's not safe anywhere, it's not safe everywhere, because if you see a spike in cases in any region, it would quickly pass back from the northwest to the Midlands and back to London. So I'm constantly arguing for a national approach to this, but I think we will be able to manage the situation better the more we have that regional breakdown of information so that people can see what's happening on the ground. Thanks, Ross.
Thanks, Andy. Kevin's got two follow-up questions on care homes. Care home staff tell us that they are going into work with COVID symptoms due to a lack of sick pay. Some local councils have signed up to cover the cost of sick pay. Why not all, and will they be doing this? And the follow-up on that is increasing reports of care homes being infected because they've accepted patients from hospitals who've had the virus. What, if anything, was done in GM to try and protect against this, and could it still be happening?
Well, again, thanks, Kevin. So on the first question, I think I'm right in saying there was a survey of Unison care workers, Unison members, some 2,500 from the northwest, 80% of whom reported a fear that they wouldn't be paid if they needed to self-isolate, or indeed if they had symptoms. And the survey found some evidence that people had stayed in work. Now, I would, before putting this at the door of any council, say it's the failure of our political parties to properly fund social care in this country, such that we've arrived at a position that people who are working in care, looking after other people's relatives, aren't enabled to prioritise their own health or the people they care for because of the outrageously poor nature of their terms and conditions and the lack of protections that they have. Now, I am pleased that some of our councils have stepped in to cover this, but when we have a situation where our councils are not receiving the funding they need to do whatever it takes to deal with this crisis, then I think it's very difficult to lay the challenge at their door. But of course, I would continue to encourage them to help if they could. But really, this is a responsibility for national government, in my view. In terms of care homes, numbers of infections in care homes, obviously that was the national policy, and GM wasn't able to step away from it in the early stages of this crisis in any way other than anywhere else. I think that there has been a failure at national level to see the issues in care homes. We have introduced a system that allows much greater vigilance now of what is going on within our care homes, although we've had to build that, as you know, in recent weeks. But that figure I gave you before, Kevin, of around 34% of our care homes today reporting outbreaks, that is a figure that we are able to provide because of the work that we have done and the extra vigilance that we have through our new alert system in care homes. But overall, this is a picture of a failure to see what was happening in care homes at an early stage, and that failure was at a national level.
Thanks, Andy. We're going to take a question from Rowan Bridge from Radio 5 Live. Does Manchester, Greater Manchester, still have more hospitalisations than anywhere else in the country? Why do you think this is? And if the problem is significantly worse on a regional level, why do you oppose regional changes to the lockdown?
So I think it is the case that we have more people in hospital than other parts of the country when we're looking at it from a northwest point of view. Why is that the case? I think it's because of the link between the spread of this virus and deprivation. I think if you look at the northwest of England, we have a concentration of more deprived communities across our two big city regions and, of course, into Lancashire and further north that I don't think you see replicated in other parts of the country, both in terms of the density of population clustered around the cities and the levels of deprivation. And I think that is why the Northwest is in the position that it is in. My point is not a regional approach to this. You know, I've been advocating all the way through this crisis that a national approach should have been taken. And my argument is that I think the government has made a national decision on release from lockdown that has been overly influenced by the position in London and the South East. And I think it is unfair that London is represented on COBRA, but there's no representation from the English regions. I think it's right that the Mayor of London is on COBRA, but I am concerned that there hasn't been equal representation for the perspective from the English regions when it came to making national decisions about the release from lockdown. As I just explained to Kevin Fitzpatrick, I still think the country needs to move as one on this, but the decisions should have been made with an eye to the areas where the challenges were greatest, rather than where the situation has begun to ease. And that is the concern that I'm voicing. I still think it's right to go as one nation, but on a very cautious, safety-led approach. And my view is that announcing things on a Sunday night without having the regulations in place and the plans in place for transport and policing at a local level, and taking the country by surprise with some of those plans is not a safety-led nor a cautious approach. And I'm making my views clear about that, because these are incredibly important matters of public safety, and I believe we need to proceed in a more cautious way than we have in the last few days.
Thanks, Andy. I'm going to take two questions on schools. Dean Sampson at Roch Valley Radio asks, do you think the government have got it right with reception year 1 and year 6 being the first to go back? And that's at 2:02. Mikey Smith from the Daily Mirror, if I can find the question, has also said that Joe Anderson, the Liverpool mayor, has said that in the last hour that he will resist plans to allow schools to reopen in June, saying it would risk the safety of children and staff. Are you concerned about the timeline for reopening schools?
I don't know whether the Deputy Mayor wants to say something about this as well, because she's been taking a close look at what's been going on in schools. I mean, just to make a comment from my point of view, I think in some ways the position with schools is more of in a position as I was calling for everything a moment ago, in terms of having more foresight and more ability to plan. So at least here there's an ability to look ahead to changes in schools and to plan for them. I think, of course, it is going to be the case that it's going to have to be a phased return via year groups, prioritising the year groups that obviously are closest to taking important exams. But it is going to be a real challenge to maintain the distancing, and I think the government will need to work closely with the teaching unions to work through all of the complexity around the return to school. Of course, a lot of young people's lives are being disrupted by this situation, and it is desirable, I think, that we return as many students as we can as soon as we can, but clearly, as in everything, that has got to be done safely. And until the concerns about safety can be fully and properly addressed in consultation with the unions, then I don't think any firm dates can be set. But I don't know if the Deputy Mayor would want to add to that.
I would, please, and I'm speaking particularly as a mother and a grandmother, as well as somebody concerned about the well-being of the citizens in Greater Manchester, and I'm really concerned about the government having set a target date for return, and about some of the plans for that. Firstly, I don't know what the evidence is upon which they base their decisions. There's been almost no testing of children. We don't know if children are asymptomatic carriers. We don't know if they can get the disease easily or not. There's so little known that I think the issues of safety in the classroom for children and for teachers makes everybody, I think, really uncertain, and I'm certainly concerned about my grandchildren, and I know my children aren't. Secondly, there's the issue that the Mayor raised of planning. This is an enormous challenge for teachers. I don't know who the educational and child development advisors are that are talking to the government, if any, but I think it's incomprehensible to think, if this is even possible, to start with reception children. Reception children learn through socialising, through play. Even if you've only got 15 in a room, it is impossible, and I think every teacher I've spoken to will say this, for them to keep a 2-metre distance at age 4 and 5. You know, I just cannot begin to understand the logic behind that. And so I'm really concerned, and I think parents are concerned and teachers are concerned. It also raises some of the anomalies in the revisions that the government has made. Many teachers going into school will have other children in their own families that at the moment, under the regulations continuing, they cannot mix with at all. And yet, apparently they'll be able to mix with other people's children in the classroom. I think all of those anomalies are very, very, relevant to people. They're obvious to people, and they're asking questions about them. And I think there's a great deal of concern about these proposals for schools.
Thank you very much for that, Bev. I'm going to take a question from Adam Clark, Roch Valley Radio. You've always said that Manchester's a couple of weeks behind London. Do you think that the region has a different R figure to the one stated by Sage? You referenced that earlier. And the government's target of testing 100,000 is close to being hit most days. How many of those people are being tested per day in the Greater Manchester City region?
On the second point, Adam, I'm afraid I don't have that figure, but I will seek to get it for you. I think it is around about the 10,000 mark, but I'd rather get you an exact figure rather than talking too much off the top of my head. In terms of the R figure, I mean, it's clear that the R rate does vary region by region. As I understand it, North East and Yorkshire has an R rate of 0.8. So if you take the Northwest figure and the figure for North East and Yorkshire, I think it does suggest that the north of England as a whole has an R rate that is, above what you would find in other parts of the country. I think the only difference that is the Southwest, which has 0.76. Now, this is information that we're picking up. I don't think it should be veiled in secrecy. I think this information, it is known. I think it should be out there, because I think, if rather than me sort of going back to a regional lockdown, as Kevin Fitzpatrick was asking about before, I think we are where we are is the way I see it today. The Prime Minister has announced his measures. People are understanding those measures and getting used to them. But the effect of what we've done is that there is now potentially greater risk of spread of the virus. So it follows to me that you have to then put into the public domain more information on a more regular basis about the differences between the regions, so that people can clearly understand the picture. And that, I think, is part of the time that we are now in, recognizing that there are clear regional differences. Apparently it's part of government policy to ask councils to introduce local lockdowns if there are then outbreaks in particular communities. Well, we won't know unless mass testing is got right, contact tracing is got right, and there is regular information published on the rate of infection. So the government needs to put in place all of these things. And this is why I say the announcement was premature. I would argue they needed to be in place before any change was announced. Instead, we find ourselves in a situation where we're now trying to rush to put them in place so that we can provide the reassurance that we need to the public.
Thanks, Andy. Just to follow up from Hannah Miller on that point, where did the regional R number come from?
So this is a figure that is held by Public Health England, as far as I understand, and is provided to regional public health officials. So I don't believe there's any great secrecy, because I checked whether or not this figure could be put into the public domain, and I was told it could be. So I'm I'm doing that because I think it's right to, via all of you, our colleagues in the media, to inform the public. And I think the more we move to a position where we are watching the situation, not just at a national level, but at a regional level, I think that's a sensible place to get to.
Thank you. I'm going to take a question from Michael Gaffney at Heart and Smooth Radio for Andy. The reports today that local officials are struggling to access the results of COVID tests carried out in commercial labs. These are forming an increasingly large proportion of the tests performed as the overall volume of testing increases. Have you had any such issues with testing being encountered in Greater Manchester?
Yes, it's a very good question, because it was an issue that got a considerable amount of attention at our committee meeting today, and that is the problem. We are not yet in a position where there is data sharing protocols between what is collected at a national level and our own regional and local systems. And again, that shouldn't be the case. You know, we should be sharing that data so that we have got the most complete picture possible on what that testing is showing and what that then tells us about spread of the virus. And those agreements are not in place. I was told today that they are being worked upon, and we're hoping to get agreement soon. But I'm afraid there is something of a logjam on that issue. We noticed that the chair of NHS Improvement, Dido Harding, has been appointed alongside Tom Reardon from Leeds City Council to cut through some of these issues that we have between national, regional and local, and that's a welcome step. But I can report a lot of frustration on our call today about testing data not being passed down to people at our level so that we can make meaningful use of it.
Thanks, Andy. Two questions for you from the Daily Mirror, Mikey Smith. The Welsh Government is putting restrictions on bailout money available to companies based in tax havens. Would you like to see similar restrictions rolled out across the UK? And a second question, is it helpful for advice on discouraging the use of public transport to be dictated by Westminster?
On the first question, I mean, it's important, obviously, to protect jobs, but obviously I have serious concerns about funding being given to companies registered offshore who are not paying UK tax. So I think those are issues that the government has had to save jobs in the short term. But what I would like to see going forward is any use of public funding being linked to good standards when it comes to corporate governance, and particularly to employment practice. So a call that I've made particularly is that the government should use the Greater Manchester Good Employment Charter, which sets out what we believe to be the principles of good employment, a real living wage, no enforced 0 hours contracts, but many other things as well, because we believe this should be a moment where we do seek to build back better. You know, we have got people who've been out there running the country in recent times, essential workers who are often the lowest paid on the most insecure employment contracts. It can't be right. We think that needs to be seriously changed coming out of this. And yes, I mean, in the long run, I would not like to see funding routinely given to companies based registered for tax offshore. And the second question on public transport. I think we probably need clear advice nationally, to be honest. This is one area where I would say national clarity would be helpful. If we're going to say that people shouldn't use public transport, I think you need to put in place support for people to access other means of travel. So the government have moved on active travel, but you know, obviously for people here in Greater Manchester, just to say don't go back to work, but don't use don't use public transport. That is a problematic message for people here in the northwest, because many people rely on public transport. So this is what I say about things being rushed and not properly thought through, because that was a difficult message for many of our residents to hear on Sunday night. And it's why I say, you know, I'm okay with the government doing that as long as it's working with us to put in place the various means of travel that we're going to need, and particularly the funding to provide those extra buses and trams. Without that, it's hard to see how we can ensure public safety on public transport. And that's a concern shared by all of the mayors. You know, it's a reality at the moment, given the problems with capacity that we've got, that you know, we cannot, even with these reduced numbers, accept many more people onto public transport. Instead of saying don't use public transport, I think the government would be in a better place saying we are going to put funding into the cities to increase the level of public transport so that more people can use it, as well as practicing safe distancing.
Thanks very much. We've got about 6 questions left in the last 10 minutes. Dan from Police Northwest asks, what is the latest on the Nightingale Northwest? Is it being used? How full is it? And when is it likely to revert back to being a convention centre?
It's being reviewed at the moment. I think there are only a small number of patients left there now. And I think there has been a discussion about how best to use that capacity as we hopefully go into a period where there is lower demand. But the issue about it returning to a convention centre is obviously we've got to have that fallback option should we see a second spike of cases. And I think everyone would acknowledge that the winter will be a challenging period if we're in a position where there has been no vaccine. So I do know that people are debating how best to use the capacity that we have, and that there would be no decision to stand it down anytime soon because of the risk of a second spike.
Thanks. Nigel Barlow about Manchester asks, infections are still higher in the northwest than other parts of the country. Have you had the information on how people are being infected? So is that in hospitals, care homes, or from normal everyday events such as shopping and working?
Sorry, Ross, could you ask that again? I'm just, my computer is playing up.
Nigel Barlow about Manchester asks, infections are still higher in the northwest than in other parts of the country. Have you any information on how people are being infected? So is that in hospitals, in care homes, or from normal everyday events such as shopping and working?
Yes, I mean the data is the figures that I gave about the new cases that we'd seen in Greater Manchester. So every week we are presented with a figure for the number of new cases. Now there is something around varying access to testing, which might explain why we have more cases than not. So there is some debate about how reliable the new cases are. But if I look at the figures that I was given alongside the dashboard that we had this morning, Saturday the 2nd of May to Friday the 8th of May, the report I have is there were 738 new cases in Greater Manchester. So we collect that data from across our 10 boroughs and across the testing sites, and we develop that figure that we then are able to monitor on an ongoing basis. And obviously we watch it extremely carefully and will be doing in the coming period.
Thanks. Going to go straight to Richard Marsden at the Daily Mail. Do you think allowing people to travel anywhere in England from today is appropriate, or would you have favoured a limit to contain the spread of the virus between areas? In other countries such as France, a 100-kilometre limit applies.
Well, no, thanks, Richard. I personally couldn't see any justification for the lifting of that restriction. And I was struck by the tweet from South Lakes Police on Sunday night, fearing that it would create immediate pressure on the numbers of people coming in. I don't think they should have been put in that position. I can't see why it's essential for people to travel long distances to go to well-known beauty spots, and I'm sure North Wales Police will have a similar concern about the coming weekend. And I would say to people there is clearly no need to do that right now. I think you have to be mindful of the people who live in those communities in the Lake District and in North Wales. It can't be helpful for numbers of people to congregate in those places. I believe it was a mistake to do that. We shouldn't be, as we come through this, we should be obviously minimising travel around the country as much as possible, so as not to take levels of infection in one area and potentially increase infection in another area. Of course, you would want to see the lifting of that restriction in time, but I believe much of what we heard on Sunday night was too soon for the north of England, and I think this is a prime example of it.
Thanks. Michelle Livesey at Hits Radio asks, does it worry you when you see pictures from people on buses this morning who aren't wearing face masks and who can't effectively social distance because of the numbers travelling on buses?
Yeah, yes, it does worry me, Michelle, and it's why I've made that appeal, hopefully through you, to the government today to urgently give us a transport funding deal going forward that will allow us to run more buses and trams. That deal is not in place, and therefore we are going to face a challenge with regard to safe distancing on public transport until it is addressed. Obviously, there has been advice given that people are encouraged to wear face coverings. And I would ask the public of Greater Manchester to respond to that and act accordingly, so that we do look after each other and provide maximum reassurance for those who have no other choice but to travel on public transport. But absolutely agree, and this is shared by the other mayors across the country. Until we have that funding deal that allows us to run more capacity, these are going to be very large unresolved issues.
And thanks. Just given the time, I'm going to take the last two questions together because they're on a similar topic. Hannah Miller at Granada asks, firstly, have you had a response to your letter to the Prime Minister? And then, given the cases in the Northwest do seem to be falling, isn't it a case of balancing risk and getting the economy moving again? Do you really think the government is on the wrong side of that? And Jen Williams at the MEN asks, you say the government is going at the speed of London rather than areas like the Northwest. Why do you think this is? And do you believe they are consciously and knowingly putting people here at risk?
So on the first question, so it was Hannah's question, Ross. Just make sure. I can't see the questions in the chat because of a.
No problem. I'll read that one out. We can take them one by one. Hannah Miller asks, have you had a response to your letter to the Prime Minister? And given that cases in the Northwest do seem to be falling, isn't it a case of balancing risk and getting the economy moving again? Do you really think the government is on the wrong side of that?
So I'm not aware that I've had a response yet, Hannah, but we'll obviously let you know as soon as one arrives. I welcome the fact that we are beginning to see signs of a fall in the number of cases. My argument is I just feel this came too early for us, before we'd seen that sustained trend. Because as I said earlier, we've seen a rise in hospital admissions, and they're not yet at a predictable position. Excuse me. So my concern is that we just appear to have gone a little too soon before we were absolutely certain. Of course, we all want to see the economy revive, and I was arguing for a safety-led return, but I didn't envisage that would come as abruptly as it did, without our ability to plan to handle the return safely. As I just said a moment ago, we haven't got that funding for public transport to enable us to manage public transport in a safe and orderly way. So my concern is of the premature nature of this. And on Jen's question, it is of course a balance, isn't it, between getting the economy moving, but health takes precedence at this particular moment in time. And as we can see across the north of England, there are still, while they may be falling, there are still a very high number of cases here. There are still a very high number of people in hospital. there is still a large number of care homes across the north that are reporting outbreaks, as I said. So, you know, that is the situation that we find ourselves in. And no, I'm not saying that people are knowingly taking risks. My concern is whether the judgments being made are the right judgments for all of England, given the position that we are in. And I can't but conclude that the lack of ability to plan for what was announced was not a good judgment. We clearly should do this in a more orderly way than what we saw at the weekend. So, you know, obviously a balance does have to be struck. I can accept that some people might err on the side of opening things up before taking the cautious approach. Personally, I take the cautious approach, given the data I can see in the north of England. I can understand why other people come to different judgments than the one that I've come to. But I have a responsibility to protect the health and safety of the people of Greater Manchester. I won't do anything, in my view, that means that is compromised in any way. And I'll continue to argue through this period for a cautious approach and more transparency when it comes to the data about what is happening, because these trends need to be watched over the long haul rather than over a very short period of time.
Thanks very much, Andy. We've no further questions. So if either you or Bev have any final comments, or if you don't, we can finish there.
Well, yeah, let's invite Bev to say anything. If Bev wants to say anything in closing.
I only think to reinforce the message that we've been repeating, I think, in one way or another throughout the meeting this morning, actually, with leaders, and also this press conference, that notwithstanding the changes, and I think the lack of clarity for people, because although the message in part is stay at home, the subliminal message is, you know, you can go out as much as you like. And I think in terms of the situation here for us in Greater Manchester in the northwest, the situation regarding infections that are continuing to rise and deaths, people are still dying. And I think for safety reasons, in terms of our public health, I would entreat people to be very, very cautious, to stay at home and not to take any risks at all. And I'm sure that's what the vast majority of people in Greater Manchester will continue to do, as they have been doing.
Thanks, Bev, and thanks, Ross, for fielding the questions. I will just say in closing that I've tried as hard as I can to be as constructive as possible with the government throughout this whole crisis, and that approach continues, and I'll continue to work in that way. But it does depend upon good dialogue, partnership, planning, the ability to put in place solutions that help mitigate risk. And I think the last few days we haven't been able to do that, and we need to move forward on a more stable and predictable footing than what we've seen in recent days. You know, I do support the idea of national guidance to the country, one set of principles, and I continue to oppose any regional difference when it comes to the message, or indeed to the use of a lockdown. But nevertheless, within that guidance, I think it's right for people in one region to take a cautious approach towards it, as opposed to another part of the country where they may take a more liberal approach. And I think here the message to the residents in Greater Manchester is, I would advise to take that cautious approach and to minimise change at this particular moment in time, until we see, you know, a significant fall in the number of new cases, the number of people in hospital, and that we keep a beady eye on that R rate if it's published, so that we can continue to provide the level of reassurance and confidence building that we will need to the Greater Manchester public. So I'll finish there, Ross, and just thank all colleagues from the media again for joining us today. We do appreciate your attention to the briefings that we give, and then the reporting that comes from it. So thank you again for joining us, and we will see you all next week.